أهلا بيكم. In this lecture, we're going to continue our talk about the brain. We will discuss the blood supply and venous drainage. So let's begin. I hope now you know, have an idea about the variable functions of different areas on the cortex, on the brain. Because once you do so and you learn the blood supply, you will be able to come out with expectations about what will happen if such an artery is occluded and such, okay? This is the basis of your diagnosis scheme by deductions. Okay. There are two systems to supply the brain and the brainstem: the vertebro-basilar system and the carotid system. This is the carotid, internal carotid artery, and the vertebral artery. Now, if we started with the vertebral artery, remember it comes out from the first part of the subclavian and enters the transverse foramen of C6. Remember that, 6. Ascends till the atlas. This would be the second part, the first part before it enters, the second part in the vertebral column. The third part is above the atlas and piercing the posterior atlanto-occipital membrane and entering the skull through the foramen magnum, and there it is, the vertebral arteries. They give off meningeal branches. They give off the pica, which is the posterior inferior cerebellar artery, to supply the inferior surface of the cerebellum, but the posterior aspect. Supplies the medulla and gives a couple of anterior spinal arteries that unite together and descend into the anterior median sulcus of the spinal cord, and a couple of posterior spinal arteries, but they do not unite, though they descend on each side in the posterolateral sulcus, okay, to supply the posterior aspect of the spinal cord. And then at the lower border of the pons, it meets the other vertebral and unite to form the basilar artery. Now, coming out from the vertebral before the union, or more commonly from the basilar, is the anterior inferior cerebellar artery, supplies the inferior surface of the cerebellum, the anterior aspect. And pontine arteries, one of them is big and enters the ear. It's called the labyrinthine artery. Remember that, to supply the membranous labyrinth of the inner ear. Then the superior cerebellar to supply the superior surface of the cerebellum, and then ends by becoming the posterior cerebral artery. Now, the posterior cerebral artery runs backwards, as you can see here, and it gives temporal branches, anterior, posterior, and occipitotemporal branches, and on the medial surface gives parieto-occipital and calcarine main branches to supply the medial surface of the occipital lobe. This is the posterior cerebral artery. Okay, now this is regarding the vertebro-basilar system. Injury to the posterior cerebral artery or occlusion of the posterior cerebral artery will mean loss of vision and affection of memory on that side. Okay, the internal carotid system. Actually, the internal carotid has no branches in the neck. Remember that. It enters the carotid canal and emerges from it above the foramen lacerum, runs forwards and enters the cavernous sinus. It's part of the cavernous sinus, and then goes up and sends its final branches. As it goes up, it gives off the ophthalmic, and then branches called the anterior choroid branches to supply deeper structures in the cerebral cortex, in the cerebral hemisphere, I mean. And as it goes up, supplies the medial part of the cortex and gyrus thickness on the lateral surface. Gives a prominent callosomarginal branch, as you can see here, that supplies, remember the paracentral lobule, the one that has the sensation and motor function for the lower limbs, and the callosal, there's a callosomarginal in the cingulate sulcus and a callosal or pericallosal right above the corpus callosum. This is the anterior cerebral artery. Now the middle cerebral artery, the other terminal branch, goes lateral, deep in the lateral sulcus, and gives arteries to supply deeper structures, the basal ganglia and the lentiform nucleus and the corpus striatum, so they are called lenticulostriate arteries. Supplies deeper structures, and then divides into superior and inferior branches to supply the superior and inferior areas of the superolateral cerebral hemisphere. Okay, so by its distribution, it's responsible for memory too, but also for the hearing and speech centers and the upper part of the body, sensation and motor-wise. Okay, this is and that was the anterior cerebral, and that was the middle cerebral artery. Now, we need to connect both systems, the internal carotid system and the vertebro-basilar system. So simply make a connection between the internal carotid and posterior cerebrals. This is the posterior communicating branch of internal carotid, and complete the circle by an anterior communicating branch between the two anterior cerebral hemispheres. Now notice that we mentioned anterior cerebral, we mentioned the internal carotid, posterior communicating, anterior communicating, and posterior cerebral. We did not mention the middle cerebral artery. So it's not part of the circle of Willis, okay? This is for the multiple choice questions. Now, it's to make sure that blood flows in all directions in this area, especially if it will give sensitive branches called the perforated substance branches to supply deeper structures in the cerebral hemisphere. But doctors, whenever an artery divides, that's a weak spot, weak point, because the tunica media in the artery gets thinner. So it's a weak spot in the wall of the artery. And this area, especially if in some congenital diseases, is liable to aneurysms, especially at the sites of bifurcation. And aneurysm, rupture aneurysm in this area is devastating. It's cerebral hemorrhage. And you know where would it be? Epidural, subdural, subarachnoid. Exactly, it's subarachnoid hemorrhage type. And will have devastating effects because it supplies delicate and deep structures in the cerebral hemisphere. This is the stroke. Okay, so that was the circulus arteriosus of Willis, how to connect the vertebro-basilar system with the internal carotid system. Okay. Now for the venous drainage, it's a totally different map. Of course, the venous map covers all the superolateral hemisphere and the medial hemisphere, but we'll be studying the prominent ones that's present in all of us with the same distribution, like the veins you're looking at now. Now, the brain has two systems to drain its blood, either by veins, superficial and deep veins, that will eventually empty in dural venous sinuses, and then to the major, of course, outlet, which is the internal jugular vein. Regarding veins, we have superficial veins like the superolateral cerebral veins, the ones you see here, superolateral cerebral veins that will empty into the superior sagittal sinus. And to do so, they are in the subarachnoid space, so they must pierce the arachnoid and become subdural, and then pierce the dura and to empty into the sinus. Now the distance between the dura and arachnoid, this distance of the vein, is liable to be torn, especially when the brain is shrunken in size in old age. A typical case in which a male in the 70s got drunk, for example, and fell in the bathroom, hitting his head against the sink, and after 2 weeks he developed a hemiplegia. That was a subdural hemorrhage due to tear of one of the superolateral cerebral veins, and the blood, because it's a potential space all over the skull, the blood spread and didn't manifest unless it made a significant pressure on the brain. Okay, so we have also the superficial middle cerebral vein, this one, that's connected to the superolateral veins by superior anastomotic vein, you see here, of labii, and an inferior anastomotic vein, superior anastomotic vein of Trollard, and inferior anastomotic vein of labii. The labii connects it to the transverse sinus, as you can see here. Okay, so these are the superficial veins you should know. The deep veins will eventually form a big vein, which is called the great cerebral vein of Galen. This short vein you can see here. Accompanying the arteries, the anterior cerebral vein unites with the deep middle cerebral vein in this case, not the superficial. Deep is not, it's not drawn here. This is part of it, and to form the basal vein of Rosenthal. This vein, the basal vein of Rosenthal. Okay. And other set of veins like the thalamostriate vein and septal veins unite to form the internal cerebral vein on each side. See, this is the internal cerebral vein. Now the internal cerebral veins unite with the basal veins of Rosenthal to form the great cerebral vein of Galen. It's in the superior cistern at the midbrain. Behind the midbrain level, opposite the cerebellum. The great cerebral vein of Galen receives the inferior sagittal sinus to form the straight sinus at the top of the tentorium cerebelli. This is the straight sinus. Okay? This is regarding the deep and superficial venous system, the veins that you should have an idea about, because yes, some multiple choice questions ask you in these areas. It's important. The more important now, questions wise, are the dural venous sinuses. They are endothelial lined spaces between the two layers of the dura, the periosteal and the meningeal one. At the sites where the dura makes folds, like the falx cerebri, for example, making space for the superior sagittal sinus, the one you can see here, the superior sagittal sinus. It starts from near the foramen, at the foramen cecum, where a connection may be evident between it and the nasal veins. Remember that? Goes backwards at the top of the falx cerebri until the confluence of sinuses opposite the internal occipital protuberance in this area, and usually in most cases the blood in the superior sagittal sinus continues to the right as the right transverse sinus. This is the left transverse sinus, the one you see here. The right transverse sinus on the other side. See, this is the end of it, the right transverse sinus. The superior sagittal sinus has connections with blood collections at the sides called lakes, where the arachnoid villi are in clumps to form the arachnoid granulations. Remember those? To produce or drain, yes, to drain the CSF in the venous blood. So it has connections with lateral lacunae. And you saw the impression on the inside of the calvaria. This is about the superior sagittal sinus. Now, the inferior sagittal sinus is in the free border of the falx cerebri, the one you see here. See, this is the inferior sagittal. It meets the great cerebral vein of Galen to form the straight sinus, to the confluence of sinuses, and in most cases, the blood from those veins and sinuses will go to the left as the left transverse sinus. See that? Left transverse sinus. The amount of blood, by the way, in the superior sagittal sinus is greater than that of in the inferior sagittal and the great cerebral vein. So the sigmoid sinus on the right side, which is the continuation of the transverse, will dig deeper in bone. When it digs deeper in bone, means the bone is thinner on that side. That's why complications of otitis media or interna on the one of the complications is involvement of the sigmoid sinus, and this will lead to coagulation of blood, of course. When the blood gets sick, it coagulates. So it's kind of thrombosis, like the cavernous sinus thrombosis case, with different reasons, of course. So this is why it's more common on the right side, the involvement of the sigmoiditis on the right side. Okay. This for the inferior sagittal sinus. The straight sinus is in top of the tentorium cerebelli and connects the great cerebral vein of Galen, inferior sagittal, to the confluence of sinuses, and from it, as we said, the most common is to go to the left side. We've talked about the confluence of sinuses. Now the transverse sinuses are on the posterior attachments of the tentorium cerebelli to the occipital bone. They mark a ridge there from the internal occipital protuberance, going to the petrous part of temporal bone, where it will become the sigmoid sinus. See that? That is the sigmoid sinus going down to become the internal jugular vein. Before doing so, it receives the superior petrosal sinus, the one you see here, coming from the cavernous sinus. Okay? Superior petrosal. Okay, the sigmoid will end by forming the bulb of the internal jugular vein out of the jugular foramen, and that's the story of the internal jugular vein, how it is formed. Okay, the last and most common to common multiple choice questions of the sinuses is the cavernous sinus, the one you see here, this one and this one. This one with dissected dura to reveal the blood in the sinus. Now the cavernous sinus, they both lie at the sides of the sphenoid air sinus, sphenoid body I mean, with of course the scylla turcica in the middle, and the pituitary gland is residing there. So they are lateral relations to the scylla turcica and the sphenoid air sinus. Remember when we talked about the sphenoid air sinus that through it you can have access from the ventral aspect to the pituitary gland, right? In surgical access. Okay. Lots of septa sent from the dura covering this space, which is the cavernous sinus, to the bone and dividing the single cavity into multiple connected cavities. That's why it's called cavernous. Lots of caves inside. And structures passing in the sinus. Of course, the major one is the internal carotid artery. It passes from posterior to anterior and then turns up medial to the anterior clinoid process, giving off the ophthalmic artery opposite, opposite the optic canal. Okay? And we know the story of the internal carotid now, dividing into terminal branches, anterior and middle cerebral arteries. Okay, what else? Just lateral to the artery is the abducens nerve on the floor of the cavernous sinus. And from the roof downwards on the lateral wall, you have the oculomotor, then trochlear, then the ophthalmic and maxillary divisions of the sinus, of the trigeminal nerve, I mean. Of course, not the mandibular division because it has a different story. It goes through the foramen ovale. Now you know about it, to the infratemporal fossa. So they have 3, 4, 5, 5, and 6 in the floor, lateral to the internal carotid artery with the plexus on it. Actually, a branch from the plexus comes off in the cavernous sinus that will eventually go through the superior orbital fissure and to supply the eye, distributed either through the nasociliary nerve or with branches from the artery. Remember those, the long ciliary nerves? Yes. So see how many structures in this tight place. An artery, major artery, and the 3, 4, 5, 5, 6 nerves. Okay? So imagine the devastating effect of spread of infection to this sinus called the cavernous sinus thrombosis. It drains the ophthalmic vein, as you can see here, the superior ophthalmic vein. Drains means they empty into the sinus. And the sphenoparietal vein on the margin of the lesser wing of the sphenoid bone. See? It's here and here. It's the sinus of twos, 2 at front, 2 at the back, and 2 in connecting. It's connected with the other sinus by intercavernous sinuses. See those? Around the pituitary stalk. And the 2 at the back are the superior and inferior petrosal sinuses. The superior petrosal sinus is the one you see here. Drains the sinus, means the blood goes from the cavernous sinus to or through the superior petrosal sinus to empty into the transverse sinus as it becomes the sigmoid. The inferior petrosal, on the other hand, from the posterior aspect of the cavernous sinus and runs in the groove between the occipital bone and the petrous part of temporal bone to open eventually in the internal jugular vein. So it passes through the jugular foramen. So these are the connections of the cavernous sinus. It's important even as a topic for short essay. It's great for questions. The cavernous sinus. Don't neglect it, please. Okay, we're left off with a few sinuses here called the basilar sinus, occipital sinus in the falx cerebelli, basilar on the clivus. You can see them here, and they connect both inferior petrosal sinuses together. The basilar sinus with the vertebral venous plexus because it's near the foramen magnum, the vertebral venous plexus. So this explains actually how metastasis can go up through the vertebral venous plexus to the skull, inside the skull. Okay, so I hope you by now you know a good deal about the blood supply of the brain and its venous drainage, and that will be all for today. Thank you very much for watching.